Welcome back once again, and thanks for still being there. If you followed the show from the beginning, you will notice that we have a topic that is of importance this morning. We're talking on HIV. Now, HIV has been known globally to be an infection that has affected or taken the lives of 40.4 million people globally. It is a global public health issue with countries still registering infections as we speak. Unfortunately, there are countries where we've had very low data registered that are experiencing spikes in infection as we speak right now. To help understand all about HIV, from definition to symptoms, signs, infection, stigmatization, and what have you. It is a wide range of topics on this issue today. We have our guest as we discuss Nigeria's HIV and AIDS prevalence, seropositive and seronegative rate awareness. Our doctor today is Dr. Olubusayo Modupe. He is a friend to the house, is a medical practitioner, is a director of Health Insurance Schemes, State Specialist Hospitals, Ondo State, is also the project coordinator, HIV Program, State Specialist Hospital here in Ondo City, Ondo State. It's so nice to have you once again on Daybreak Africa.
Thank you very much.
So, like the topic suggests, we're talking about HIV and, of course, HIV and AIDS awareness. I would want you to help us understand what HIV is and, of course, AIDS, the difference between both.
Okay. HIV simply means human immunodeficiency virus. When a person becomes infected, and we say that person has HIV infection. AIDS, which is acquired immunodeficiency syndrome, is the end stage of HIV infection. So simply, and as the name connotes, HIV, you see, when the virus get access to human body, what it does is to attack the immune system. That's why they call human immunodeficiency. So once it attacks the immune system, then the person becomes immunodeficient. What is immune system? Simply is the body defense mechanism. It's like the soldier of the body. And so the only thing HIV does is attack the defense. It's just like if you want to take a country, what will you do? Attack the armed forces. Then the country is under your control. So that's what HIV does. Get into the body, attack everything that defends
The body.
the body. And so the immune system becomes deficient. There's lack. And because of this, different illnesses will start to crop up. Even illnesses that you don't even expect will start to crop up. Then we now call, that's what we now call opportunistic infection. Because of the low immunity, a lot of things will start to crop up.
Now, when I was doing my research, I was shocked to discover that we could actually discuss HIV and AIDS infection in 3 stages. We could discuss in the first stage where the symptoms appear. We could discuss in the second stage where it begins to get aggressive. And of course, we could break it down to where we're now talking about the AIDS infection itself, where different symptoms like tuberculosis and the rest begin to rear their heads. So, fine, you've given us a definition. Could you please give us these 3 stages, talking about the signs and symptoms from the first stage, the second, till we get to the third stage?
The truth of the matter is that the WHO staging is even 4.
Okay.
Stage 1, virtually there's nothing happening. a person is exposed, can just have fever, normal thing, and it's okay. You might not even know you are infected. And that's the asymptomatic stage. There's virtually nothing happening. But during this time, the virus continues to replicate, multiply in the body, attacking the body defense mechanism. And once that starts, now, depending on the immunity, the time from that asymptomatic to stage 2 varies. Some might be very fast if already the immune system is poor, or if it's good, then it can be longer. Again, that length of time can also be dependent on the virulence of that particular virus. So from there we get to the symptomatic stage, which is between 2 and 3. From in 2, now there can be recurrent fever. In this environment, we see I'm always with typhoid fever. I'm always treating typhoid fever. I'm always treating, because they virtually feeling unwell for a long time. And you know, in this environment, once you are not feeling fine, you think it's typhoid fever, especially when you are when you have used the common anti-malarials. So most times, especially when people travel in from another state and they come in, have been treating typhoid for a long time, it's not going. The high index of suspicion, and with the experience, one of the things we will request is that that person have an HIV test done. That can be that. Then at this stage, they start to lose weight, but not mad. Then there can be recurrent passage of watery stool. Passage of watery stool, which is most of the time that the normal drug you use will now not work. You know, naturally, even not if you are not a doctor, and you tell a friend that I'm having running, so we call it running stomach, they will tell you, go and buy this, go and buy this, and immediately you use 1 or 2 doses, you notice you are okay. They can present at that stage 2. Then we can also have skin rash. Very unusual. Many years ago, somebody very close to me, it was the skin rash I saw. How is this? It's florid. Why are you having this kind of rash? I now asked the person to run the test, and it came out positive. So skin rash can be, in fact, they can have cough. But really, when we have TB, it's already in stage 3. When we have TB, then there's what we call oropharyngeal candidiasis.
Coated tongue.
Coated tongue. But naturally, if it's just on the tongue, it does not matter much. We are not, that might not be significant. But once it's oropharyngeal, that is from, you are looking at it and you notice that whitish patch extend to the throat.
The tonsils.
Yes, down. That you are even seeing it. Then that is significant for HIV. Of course, in stage 3, there is, of course, more loss of weight. There are this time other things. You can have different type of meningitis. And a lot of this, we are entering stage 4, fungal meningitis, and even there are some cancers
associated.
Yes, Kaposi sarcoma. They can even have cervical CA. All this will be aggressive, not usual. But most of the time, when we have somebody having recurrent fever, common presentation, loss of weight, cough. In fact, with insurgence of HIV, that was when there was increase in TB too. Because virtually everyone of us at one time or the other has been exposed to that.
Tuberculosis.
Yes. But because your body immune system is working perfectly, it's not able to, you are not coming down with the symptoms, but it's just laying there, not doing anything. But anytime
Condition
immunity
becomes favorable,
yes,
pops up.
in fact, virtually in all TB lab, TB clinic, one of the important tests they do is HIV test, because there is a lot of time co-infection. These are the common presentation. I don't also want to, if I talk about Kaposi sarcoma, how many of that will be confusing. Leave that to the health practitioner to, but the simple thing that occur commonly, that's what I just want to emphasize.
Now, when we talk about its transmission, many believe it's typically through is sexually transmitted, typically amongst other means too. But currently, I don't know if it's the Gen Z mentality or new findings. I hear very often that it is not necessarily sexually transmitted. That you could actually cohabit or have something to do with someone that is positive and nothing could happen to you even while you're negative. How true is this myth or findings?
Mode of transmission. The number one mode of transmission is unprotected sexual intercourse with an infected partner. That's the number one. But of course, it's not, everything is not, but majority is true unprotected sexual intercourse with an infected partner, because the partner must be infected before infecting you. There are other ways. Blood and blood product transfusion. That has nothing to do with heavy drug abusers. You know, those who are into drugs.
Heroin.
They share needle. Just one person just need to be infected. You know, they share needle, anything they do, they just immediately. And so the same thing when we share sharp skin piercing instruments and it's not properly taken care of.
Tattoos, people who go for tattoos.
All these things.
Nose piercing, ear piercing.
Once you do that and immediately another person uses that same piercing instrument, once that person is,
as long as there's a drop of blood from an infected person,
it can be
that's
transmitted.
all.
Now, of course, there is mother to child transmission. That's not sexual intercourse. The mother who is positive can transmit to the unborn child either during pregnancy, during labor, at delivery, or during breastfeeding. That's it. We know those are the main ways of transmission of HIV.
The part of using a sharp object, like say a needle, I notice many in their workshop tend to use fire in the name of sterilizing those objects.
Now when you go to a barbing salon,
how effective is this method?
Again, we know. If the truth is, HIV is a very weak virus. What do I mean by that? Is that we know it does not live for a long time outside the body, unlike hepatitis B. And we also know that our popular bleach, hypochlorite, in some dilution will kill
the virus.
Yes, I barb too, you notice Of course, the time of exposure, is it long enough? When we talk about prevention, I think one of the simplest prevention is that if you barb, having your own personal clipper, I think we solve that. Because the truth of the matter is, or having multiple, if the barbing salon should have multiple, what's it called?
Clippers.
Clippers. Use, sterilize, so that another one is being used. It's not the kind of the quick one. You finish from one customer,
then you do the same, you go straight to another customer.
They mix a lot of things, but we just need to be careful.
Now, again, I want to create the awareness. I don't know if you agree. People who do manicure, if you go to our market, you see women lined up in crescents, they line up waiting for their next turn, for their nails to be filed and for them to fix their nails. Do you think that is another way that HIV, the virus, can be transmitted?
Well, I'm not into pedicure or manicure. The procedure, is it possible for blood?
Yes, yes.
Once it's possible, anything that can cause blood, because that infection lives in the blood. And so if there's injury to one, and that same instrument is used for you, and you're also injured, there can be blood exchange and infection exchange during that period.
Another
so we can also, everybody can have their, and for women that, you know, they usually, this thing you put on your head.
The wig, the needle.
The needle.
So simple. It's advisable to go with your own needles, go with your own manicure sets, and of course ensure that the woman fixing should wear a glove or wash their hands. Would that suffice?
If it's washing hands, might not for HIV infection, but even for her, if she has an injury, for example, a wound on the hand,
and she's fixing an infected person.
So, yes, and so it's important for her to even cover that wound
before fixing. What about those people that do their manicure from those abokies? With
that one is worse now.
Please, doctor, say something. Say something to them.
It's terrible.
Because it's cheaper.
Of course.
So people patronize them.
And the truth of the matter, there's no law that says that you must even do manicure and pedicure. There's no law. So if you don't have money to do it in the appropriate place, then you can do without it.
Let's talk about level of stigmatization currently. I remember once upon a time when it comes to couples, the intended couples, you know, but want to get married. If one of them tends to be positive, the marriage is called off. It has to be called off. There is no negotiation. We had, you want to say something?
Yes, I know. I will speak on that.
Okay. Once an individual is positive, the marriage is called off. You know, there are high stigmatization when it comes to HIV/AIDS then. But for now, like I said earlier, we now call it the usual malaria, typhoid kind of a sickness, so it doesn't matter. How is the level of stigmatization now? Is it still high? Is it low? Is it just okay at this point?
The truth of the matter is that at least more people are aware of HIV, and one. Then number two, even big people. You know, when we talk about people are also, some of them are infected. And so there's a law against stigmatization and discrimination against HIV. It's a national law, and most states adopted it. You know, I smile when you talk about marriage. Who will call up that? Who is supposed to call up that wedding? And most of them is the pastor that does that. That's illegal. That is illegal.
Why is it illegal?
Why are you calling off? being positive, if the parties after counseling decide to go on
with the marriage,
nobody has the right. And I tell them, because I've been involved with the archive for a long time, if the church refuses, go to the court. No court will refuse you.
Getting married.
No, we should stop that. And you know, all times when you seek employment, HIV tests is part of the test you need to do.
Yes.
But that has reduced drastically, because in fact, if you bring that for any of those from to me, intentionally, I will not request for that test. And I will also certify you that you are fit. If you are already employed, and you later in 10 years, or even you are the executive director of that organization, and you become HIV positive, will you leave your post? So having those tests done is also a form of stigmatization. Because the truth of the matter, if you see that the result is positive, you may not employ that person.
So, doctor, let us talk about risk factors and the reason why you will take the stance not to expose, or should I say, why you would be against any organization asking for HIV test. Again, while we were doing our intro, we did say that HIV is no longer a death sentence. Is that the reason why you will take the stance by saying that couples who discover and later agree to go ahead to get married shouldn't be stopped by the church, and why you're against companies conducting HIV tests for intending or potential staff? I would really want you to break that down by linking it with risk factors.
No, the truth is this. Currently, HIV is like a chronic disease, just like the hypertension and the diabetics. Yes. If you are HIV positive today, once you are on your drug, you use it every day for the rest of your life. If you are hypertensive, you are going to use your drugs every day. If you are diabetic, you use the same thing. And with the current knowledge, if one is on drug, the possibility of even infecting the other party is almost zero.
Once people take their antiretroviral drugs,
yes,
the possibility of infecting other people
is almost
zero.
Zero.
Can you make us understand?
What does the when I was at during my introduction, I said what that virus does is attack the immune system, overwhelm it, and take over.
Breaks it down.
Yes, and take over
the entire system.
Yes. So with the drugs, what happens? The drug will attack the virus. At a stage, there's what we call viral load. We want to count the number of viruses in the blood. At a stage, we even say it's undetectable. That is very low. It's not zero. Depending on the machine, some less than 50, some less than 20 cells. That is very low. At this stage, the possibility of infecting another person is almost zero. And that was the principle at the beginning. When a pregnant woman is pregnant, a woman is pregnant and is discovered to have HIV, the woman is placed on drugs and she will deliver, and the baby is not positive.
Baby comes out negative.
Negative. The baby use drugs for some time. The mother will continue her drugs even during breastfeeding. Breastfeeding, because the viral load is low, it's not infecting. And so it's the same principle. Husband and wife, a lot of them, we call them discordant couples. One is positive, the other one is negative.
And it's still together.
Yes.
Without protection, there is no transmission at this stage.
Yes.
Because the infected patient is taking the antiretroviral drugs.
Yes, and it's virally suppressed.
Okay. Okay.
So the possibility, although the truth is that we won't say it's 100%. You know, I said the possibility is very low. But I'm not protected 100%. Very low.
But doctor, while I was doing my research, I was shocked to discover that this percentage that you're talking about, that there have been instances where, in very rare cases, where patients who were exposed to HIV, who were on their antiretroviral drugs, eventually tested and the virus was not found.
And that's, you know, that's what I'm saying. You know, when you notice, if I tell a patient that virus is undetected, you see, you will tell me that there's no virus to have been used. That's what we hear all about most of the time. Well, the doctor himself told you the virus is undetected. You go about spreading the good news that I've been healed, that the virus is no more there. That's not what the doctor is saying. It's counting. We notice that it's very low now.
So at this stage,
virally suppressed.
What advice do you have for a patient who is listening right now and has gotten that verdict? Do they stop taking the antiretroviral drugs?
If they stop taking it, the virus is still there. It will come back in full force.
With vengeance.
Exactly. And that's why regularly to government of Nigeria, that test is done every year, the viral load. And if it's abnormal at any time, then the person we need to see his doctor regularly. We do adherence counseling. We call it enhanced adherence counseling, so that we know why, what caused it. Because it can get to a time that drug is failing. It's no more working. And some of the simple way we will know that this drug is not working is when somebody has a viral load that is suppressed before, and suddenly that person
begin to spike.
There's a spike, and the person, after counseling, maintains that he's using his drug as at when due.
What happens then when this happens?
Then of course, there are different groups of drugs.
To counter it.
Yes, that means that probably that virus is now resistant to a particular drug. We now change to another line of drugs. And in developed places, they even do what they call drug resistant testing. You know which drug the virus is not responding to anymore, and so that a new set of drugs will be prescribed.
And we do not want you to blink. When we return, the conversation will continue. Stay with us. Welcome back. It is still Daybreak Africa. Our guest is still in the house as we take a look at Nigeria's HIV and AIDS prevalence. Trying to find some definition, transmission. We stopped at risk factors. I would want our doctor to continue his line of thoughts as we go to diagnosis this morning. So you told us about risk factors. Have we really dealt with risk factors?
We have not.
Okay,
I can quickly.
Yes, please.
Start from there. Now, the young age group, because they like to experiment. They are the ones that have multiple sexual partners. Women, young women, they are vulnerable because a lot depend on others, for example, for school, to pay their school fees, you know, all this kind of the popular aristos. Then people with multiple sexual partners, either serially or concurrently, then you know, the people, health workers, we are at risk, not because of anything, because if you don't protect yourself, to us there's what we call universal precaution. What that means is that you treat every patient as potentially infectious. Once you do that, you are protecting yourself. Then of course, those who need to leave home for a long time, for example, the uniform men, your family may be in Ondo State and you are asked to report in Borno State for a year, for 2 years, uniform men, military, police, because all these people, it's all risk factors. Then those who need blood and blood products that are transfused regularly, sickle cell disease patients, those with cancers, then hemophilias. These are all common risk factors. I must not forget to talk about musicians. It's a risk factor because today you'll be on tour to this place, tour to this place.
Come in contact with different fine girls.
And you know, all those things, those are common risk factors.
So with all this that you've said, this is a huge category. What you have to say in terms of risk factors to those that are watching what to do. We need to say it over and over again. You've mentioned different category of people. Yeah. How do they prevent? How do they stay safe? What message? Because you mentioned military men, musicians. You mentioned them. What they made them do? Made them not get them.
Well, probably when we are talking about prevention generally.
Okay,
yes.
Let's talk diagnosis.
Yes,
Ezekiel has been so quiet, but let's talk diagnosis.
Probably is afraid that probably I brought the kit.
I don't know. It just went rogue on me on stage.
It was moment to learn. But I guess since I've been beckoned on to speak, for us who go into diagnosis, I tend to wonder our current state of HIV/AIDS prevalence in Nigeria and how has it evolved over decades. Like I said, the way we sing and shout and the way HIV/AIDS was pronounced in the past is not as pronounced now. So what evolved, what changed, how has the prevalence been in Nigeria currently?
No, the truth is that the prevalence is dropping.
Okay.
We have less new infection and we have less death.
Okay.
We must always appreciate the government of America because treatment of HIV in most centers are done free of charge.
Please, I want you to tell our viewers again because a lot of people shy from even going for a test because of the money.
Testing, at least in most government hospitals, supported by US government, it's free because they supply the kit free. You see, there's something the world is talking about because by 2030, how many years time? That's 6 years time. The world wants to end AIDS as a pandemic, as something that will run about, reduce new infection to near zero. That's what the world is working about, and it's based on three main tripod. The first one is we must get everybody tested so that 95% of those who are positive know their status.
And begin treatment.
Yes, and begin treatment. That's the second leg. And once we begin treatment, that out of all these people that we have tested positive, 95% of them has placed on drugs. Then out of those people placed on drugs, at least 95% are virally suppressed. As I said, if you are virally suppressed, the possibility of infecting others is also very low. So currently we are using treatment as a form of prevention.
Treatment as a form of prevention.
As a form of prevention. Because once you are virally suppressed, the possibility of infecting is also very low. So as I was saying, the prevalence is dropping. Death from HIV is also dropping. We can do better.
Let's talk a little about the most affected demographics and what factors tend to contribute to that higher risk.
The younger age group, the youth.
Just because we are supposedly expected to explore, is that why?
Most of the time you explore. They explore. They are likely going to have multiple sexual partners. When I talk about HIV, to be modest, I say that the typical university, not necessarily all, but most, if for example, your parents are in Lagos and you are schooling in Ondo, at least 4 IS0 in Ondo, there's likely you have a relationship in Lagos. Most likely. Am I making a point? And there's also likely you have a relationship
on campus.
On campus, making true. And most also have the third one, the one who pays the bill. The big man outside, making 3. You know what that means? Just one person, if it's the big man, or is the campus guy, or the home guy that even everybody knows at home, needs to be infected.
Now, since 2020, is it safe to say the emergence of COVID-19 tends to impact the testing and treatment of HIV/AIDS in Nigeria?
No. We have always been testing, we have always been treating. But what COVID-19 just did
change
to
the focus a little bit.
Program, no. It changed to the program. Is that, for example, during COVID-19, we took special care of our patients because they have low immunity already. If they come in contact with COVID-19, they are gone. Well, now, it helps us. For example, it was during COVID-19 that the time they come to clinic, we know they can come, the appointment can be spaced better. So those are just the impact. A lot of trainings that we're going about, you notice that we can do a lot of online. There are a lot of programs that came up that we can talk to our patients too. Instead of asking them to come for counseling, you can speak with them. Those are the impact of COVID-19 on HIV program generally.
So before, the moment HIV came into being, and then it was said we had no treatment for it per se, just maybe a little treatment to help you, keep you going. People tend for alternatives. People were spiritual, people were to traditional healers. So I want to ask, how can we, or what are the roles? How can we engage and the roles of traditional healers and alternative medicine practitioner in the prevention and treatment of HIV?
They can be of assistance in prevention, not treatment, because the treatments are domiciled within the hospital. Again, with COVID-19, we have even reduced hospital-based treatment. There are community pharmacies that can give drugs now. So the same supplied to the hospital, supplied to some community pharmacy that have been trained. There is even group within community so that everybody can have access, except they buy into after training. But what we expect, traditional part attendance, even churches. I have churches, after doing their own, the spiritual something, they will still call us.
Come and do the test.
Yes.
Come and do the test.
Come and do the test. We have done our deliverance, but the one remaining is physical. So we just need to find a way of collaborating, because the truth of the matter, less people come to the hospital, more go
to the church.
And
to
other
spiritual houses, alternatives.
So we just need a way to get everybody. If the alternative providers are also aware, they are educated, where they should know their limits. For example, you went to a traditional birth attendant to deliver, and that woman was not tested for HIV. And there are multiple people who are to deliver at the same time. And they just deliver and use the same thing and use for another person. It's a big problem. So we need to educate, get them involved, because they deliver more even than government hospitals.
Government hospitals. And it's a big shock. I want to reveal something here that educated people go to this traditional.
Yes.
It's not only illiterates that go to. There was a particular case where a very educated person I found out went to a traditional home to give birth, and when I asked, the person told me it was financial problem.
It might not be financial problem. No, let me tell you.
Because I really wanted to find out
let me
the
tell
logic
you,
behind it.
For example, if you have had 2 CS, 2 cesarean section to deliver, to a doctor, they will tell you your next delivery must be through CS2. Nobody wants to hear that. But the traditional bar attendant will tell you there's no problem.
I can do it.
You will. They can try. The doctor is not saying you cannot, but it's risky, because you have had to injury on your womb. There's a possibility of that place to rupture.
Showing the 3rd bed.
Yes, subsequent bed. So that's why you are advised. They won't even allow you to fall into labor before they start book you. But having a surgery done and somebody tells you no problem, which one is easy to?
It makes sense. It
makes sense.
Yes.
So those are some of the things.
What about the little disparity? Should I say little or major disparity between rural and urban prevalence in access of services? I don't think we have gone to the point where the mama in the village has this easy access for testing and treatment, or the farmer down in a rural area have this easy access.
Yes, that is true. But again, if we do well, all these communities should have a basic health center, minimum. And so if there's basic health center in that place, that's an access. Because all these communities are supposed to be served by health center. But I know we'll get there. And again, most of them also come to town. They don't always stay there. Once they come to, they should do it in the.
Which brings me to the roles of our government, the roles government play. Has it really increased? Is it decreased? Or it has not been in the first place?
Well, the government is trying. But the truth of the matter is that the government is taking ownership now, because HIV program from inception has always been donor
based
based.
in Nigeria.
Yeah.
Because I've had myself tested twice for HIV, and I've had a situation where I encourage people to go for test, and the feedback is, will you follow me? And I'm like, yes, I'll follow you to go get yourself tested.
No worry.
And I've done that.
When we want to talk about HIV again, when I'm coming, I will come with my team. We bring the testing.
Let me tell you, I tested at the office in Lagos, KAFTAN branch in Lagos. They came to the office. Some of my colleagues were too scared to find out.
Some people,
and I gave myself to.
Some people will disappear. You won't see them.
I
again.
tested at the office. I didn't shy away from it because I know that early detection means longer life.
It's so simple.
So I am that aware that the sooner someone finds out about their status, the longer they will live, because I know that HIV is not a death sentence. I have that awareness. So when they came to the office, I was the first in front to draw blood. So I know if it is you know, if it's so. Let's talk about diagnosis.
Yeah.
Let's talk about diagnosis before we go to prevention, and of course we talk about the seropositive and seronegative stigmatization or whatever.
But just for going to diagnosis shortly, I tend to wonder as to the intersectionality of mental health with HIV a patient. How does it really correlate? I'll correlate that with tuberculosis because you said it could be in the third stage. So I understand tuberculosis and HIV, you know, but mental health.
No, you know, the truth of the matter is that counseling is an important aspect of management of HIV.
I think that should be after diagnosis, after finding out if you're positive or negative.
Yes. In fact, even before you do tests, there's what we call pre-test counseling. Because we must get you prepared
for the results.
Yes. If it's positive, if it's negative. After the tests, we again counsel you. Well, this is the result. It is positive. It is negative.
What to do?
Yes.
Okay. So before we get there, let's talk about diagnosis.
Yes, diagnosis is simple. There are different kits that is used. Currently, there's even oral kit now that you can
even do home tests.
You can do home tests with the saliva. It's not as sensitive as the blood tests.
But I learned that there are 3 different types, minors or inclusive of the home kit. Can you take us through?
No, yeah. You see, what we do normally, what we do here is what we call the antibody-based tests. There's also antigen. They are more. Those are not routinely done. But the antibody-based test is the one we do with rapid tests. I won't mention any kits. And what we do is that there's one we do first. If it's negative, it's agreed that that person is negative. Because it's sensitive, but it's not specific for HIV. But if it's positive, we'll still do another test, which is more specific to HIV. So, if the two are now positive, we confirm that that person is positive. There's also another group. The first test is positive. The second test is negative. Which one will we pick? We'll now go to what we call a tiebreaker, which is better than the 2 kits.
The tiebreaker.
Yes. From the tiebreaker, so what the result comes out with is the position is either positive or negative.
Negative.
Or at times we say reactive or non-reactive.
Non-reactive. Okay.
Those are the possible.
So let us now progress. Now we're done with definition, signs and symptoms, transmission, risk factors, diagnosis. Before we go to prevention, which is general, let us now break it down to seropositive and seronegative awareness. What is seropositive? What is seronegative in conjunction with HIV and AIDS? And how do we create that awareness for Nigerians to prevent the spread of HIV?
It's so simple. When you say seropositive, what we are saying is that the result is positive. That's reactive. When we say seronegative, then that means the result is negative. The person is non-reactive. So that's it generally. And so it's so important. If it's seropositive, it's not a death sentence. You can live your normal life. Just know that the person who is positive will use drug every day. As at now, I don't know tomorrow. You know, the Oyinbos are working day and night doing research. There might be a cure tomorrow, but as at now, there's no known cure. Just as there's no known cure for hypertension and diabetes.
How about hepatitis?
And cancer.
How about hepatitis? Is there a cure for that?
Yes, one can become seropositive and become seronegative. So that means the person is cured for hepatitis. And so, the most important is use your drugs. That's for
Seropositive.
use your drug as prescribed. I know one thing about the use of drug is they don't miss drug. They must not miss drug. Their drug is daily drug and they use it the same time every day.
What happens when they miss the timing or miss a whole day without taking?
That is terrible. You know,
For seropositive patients.
Yes. That's why we do a lot of counseling. Even at every clinic, they are saying counsel. You must not. Because, you know, we have you see, when you use the drug, it's suppressing the virus. Perfect. So, you know, at a stage, the drug concentration will start to drop. And so as it drops, you are taking the next dose. So it's maintained at a level. But if you don't use the drug, as I told you, that means the concentration of the drug will drop. At a stage, the virus will notice, this poison that is killing me is not as effective as before. So they quickly
Multiply.
And most of the time, they multiply with variants.
Not the way they started.
Exactly. So, for example, if
They start this way,
where the head
they
can
go
be
this
as
way.
small as this before, just an illustration. By that time, you notice the head can now become as big as this. And is that kind of virus variant that will be multiplied. Even if you now reintroduce the drug, you will notice that the drug is not
it's not active anymore.
active. And once you notice that, you will now manufacture that one massively.
And this could happen in just a tick of hours.
It's so important. You know, you just give, when you give chance, anything can happen. So we don't. We want them to use their drug every day, the same time. And so that's why they are the one to pick the time. The health worker
That is
don't
comfortable
pick,
for
yes.
them. And stick to it.
Yes. Yeah. I don't miss NTA News. NTA News, if they still do it, it's a long time. It's 9 p.m. Abi. So you just notice that. So once those do it, there's a particular sound. Once we hear that sound, you know, it's time for my drug. If it's prayer, I don't miss my prayer at 6 p.m. or 6 a.m. anytime at 7 a.m. I know I don't miss it. So once you know, I know. Before I start this praying,
take it.
So they are the ones that pick the most convenient time for them. And apart from that, they live a normal life.
Because of time, seronegative. Let's quickly go to seronegative.
Seronegative. That means they have done something well. At least they are not positive. They should just maintain currently what they are doing, that they are negative. And if perchance they have not been following, what is it called? The normal precaution they are supposed to, then it's time to remind them that they must follow the normal precaution. And even for those who are positive, we still tell them to practice safe sex. Why? You are using your drug. But if your partner is also infected, you might not even know, and is not using drug, anytime you have sexual intercourse, that person will be infecting you with white virus. She is not using drug. Different viruses, different type will be manufacturing, but you are using. But it's still infecting you. Fresh infections are coming. At a stage, the white virus will take over, and the drug you are using will not work again.
Well, we are done because of time. In just a few seconds, your last word of advice to the viewers.
ABC, that's the prevention method. Abstinence. If you can do, especially for not married, wait till you are married. B, be faithful to your partner. No side chick, no side hustle. C, if you can't do A and B, consistent and appropriate use of condom, male and female.
We want to thank our guest for being on the show today, where we've been talking on Nigeria's HIV and AIDS prevalence, seropositive and seronegative rate awareness. Our guest, Dr. Olubusayo Modupe, is a medical practitioner. We appreciate you for honoring our invite as usual.
Thank you very much.
That's the show for today. Like I said, again, wrong with everything that you heard here, from the business package to being careful about HIV and creating the awareness and staying safe, and of course, every other good thing that you picked from the show today. I am Anire Binitie. Stay safe and bye for now.
Have a wonderful day ahead. I remain Ezekiel Ogar.